Pretty much from birth, it seems we are taught to just listen to what the doctor says and do it. That includes vets. Well, that is not such a good idea. And I really do consider it critical to get a copy of the blood test every time you do it. Now, that is going to confuse you. If you get full blood work, there's a lot of numbers, a lot of abbreviations, and you won't know what most of them mean, the significance, which ones to pay attention to, ignore. So I'm going to do a relatively short run through on some of the key numbers, particularly for hyperthyroid cats, and what some of them mean, which ones you can probably ignore, and see if I can simplify things for you a bit, give you a starting point, and I will include a link to the best website I know that discusses the numbers. Just remember, when you look at that, almost every number can indicate a serious problem. That's usually not what the problem is. But the vet on that site is good, and he lists the different possibilities. So don't let the numbers scare you. And don't let the numbers control you. We also have a tendency sometimes to think that numbers are absolute. They are not. It's especially true of blood test numbers. What we call normal is an average. It's like saying, normal human temperature is 98.6, and I have never met anyone who has that as their own healthy, normal temperature. If Jenny got up to 98.6, we'd likely have to take her to the hospital. She'd have at least 1.5 degrees of fever. So look at the numbers, learn from them. Do not let them control you. Okay. I'll have to do this in at least 2 videos. In this one, I'm going to talk about the chemistry and the endocrinology. Chemistry covers things like glucose, creatinine, the liver enzymes, proteins, potassium, phosphorus. And if you want to remember the name, think potassium and phosphorus, which should remind you of chemistry. The first number quite often, and what I'm talking about is what they often call a senior wellness panel, which is full blood work that includes chemistry, hematology, endocrinology, and a urinalysis. We'll cover all those in the 2 videos. Okay, glucose is quite often first on the list for these numbers, and it's not unusual if glucose ends up a bit high. Don't worry, a bit high is normal, partly because stress raises glucose, and in cats it can raise it maybe even 100 points in a relatively short time. And of course, food raises glucose. So unless it's a fasting test, the glucose is only a vague guide. So a little high, don't worry. A lot high, then you follow up with a fructosamine test, which gives you more complete information. But we're talking about, 100, 150, 200 points above normal. Then you follow up with a fructosamine. And someday I'll have to do some videos on diabetes. We've been down that road more than once. A couple of numbers that are often high that you almost ignore. would be cholesterol and amylase. They are rarely significant in cats. So unless there's some symptom or some other numbers supporting the idea that there's a problem, if cholesterol and amylase are even very high, probably ignore it. At the very least, don't freak out. Just look at the other numbers, look at any notes that might be included. Okay. Kidney numbers, the most common on a chemistry are the BUN, B-U-N, all capitalized, creatinine, and SDMA, which is only from one lab. I think IDEX is the one who created it. BUN, it's going to be high a lot because it's so easily affected. It's not meaningless, but it's pretty darn close. Again, it's another one of those that unless there are some other numbers out of whack to support it, it's not meaningful. And if those numbers are out of whack, you don't need the BUN usually to tell you anything. And some vets will judge kidney health by BUN. Don't fall for it. A little dehydration will kick the BUN up, and a recent meal and a high protein meal raises BUN. And high meat protein is a cat's proper diet. So the foods that cats should eat will raise this number, and vets will sometimes still fall for it. SDMA, again, is supposed to give you an earlier indication if kidneys are having trouble. Maybe it does. Maybe. But if so, it's giving you an indication at the point where the most you would do is increase water intake, and generally speaking, that's something you should do in an older cat anyway. Just good kidney health approach is a good quality meat content, good moisture level, minimal fillers. And that's what you should be doing to start with. That's what you would do if the SDMA told you there was some trouble. So I don't find it useful. And while the lab claims that it is a stable test, we have seen some really wild results, nonsensical results. It is not all that stable. So on the chemistry, we are still with the creatinine as the best guide for kidney health, and it's only so-so as a guide. Dehydration can affect it, not necessarily as much as it does BUN. A high T4 will usually force creatinine down. It's what we call masking the kidney health. I've got a video on that if you want more information. Take a look there. But creatinine is your best guide on the blood work. Urinalysis we'll get to, but it is a guide. When dealing with hyperthyroidism, you don't know true kidney health until you have the T4 in mid-normal range for a few weeks. And a slightly high T4 will often cause dehydration, which will make the kidneys look worse than they are. So don't freak out if it's a bit off. Potassium is a critical number, and vets often ignore it. I still don't know why. Hyperthyroidism will frequently lower potassium. probably because it makes cats pee more. So low normal probably means you watch it. Below normal, I think you should supplement. A lot of vets won't supplement until it is very, very low. But it is something you should at least talk to your vet about. Bring up this number. Ask. You really, you should have your vet's input. While it is possible to get over-the-counter potassium, you're better off working with your vet. Potassium, you probably know that if you have a muscle cramp, you eat a banana because it contains potassium and some other, assorted chemicals, minerals, nutrients. And potassium is directly related to muscles, which means it sometimes causes rear leg weakness. That seems to be where the muscle issue shows first. And the heart is a muscle. Potassium is critical for heart health. That's also why you don't want to overdo the potassium. You need your vet's input because overdosing potassium has as much potential to cause some heart issues as low potassium does. So pay attention to this number, but don't overreact. The ALT, AST, and the ALP are all liver numbers, liver enzymes. Hyperthyroidism frequently raises one or all three of these. So if they are high when you get a diagnosis, don't freak out. You start with the methimazole and see how these numbers respond as the T4 comes down. Now these numbers will usually lag a bit behind. When T4 gets into normal range, that doesn't mean the liver numbers will already be in normal range. They'll probably be a few weeks, behind, but they should be starting down. If you start methimazole and the liver enzymes go up, that's a problem. There's a good chance you're looking at an allergic reaction to the methimazole. Only way to find out is by stopping the methimazole. And then if the numbers start to come back down, you likely have confirmation that the methimazole is causing the problem, and you're going to have to switch to some other type of treatment. And there is no other medication that you can switch to. They are all forms of methimazole. So it's a relatively uncommon reaction. It is known. It sometimes gets ignored, so it's a good reason why you need to look at the numbers. But you look at other numbers to see if there is something else that might be raising the liver enzymes. But if you have no other confirmation, then you assume it's the methimazole and stop it in order to find out. The bilirubin and GGT are also liver numbers. They are not usually raised by hyperthyroidism. Now, cats are weird. It is possible for the hyper T to raise at least the bilirubin. GGT is frequently related to bile flow. Now, this could be the bile duct. We could be looking at gallstones, but an inflamed pancreas can press on the bile duct and raise the GGT. So an increased liver number may actually indicate a pancreas problem. So you look at other numbers, maybe run some additional tests. you may have to get the pancreas in shape to get that number controlled. You got to look at relationships between numbers, not just individual numbers. Creatine kinase, usually listed as CK. It looks like creatinine, almost. It is not related, not really. This is a muscle-related number. They're usually, indicate muscle damage, stress on the muscles. It can be raised just as a test error is pretty common. The needle inserted to draw the blood can cause some damage that raises the CK, but it can indicate heart issues. So if it's a little high, it's another one of those numbers you just watch. If it's double or that kind of range, then you probably pay more attention and see if there are other indications of heart problems. If the vet has indicated that there's some issue with the heart and you get a high CK number, you may want to do something like an echocardiogram. Keeping in mind that heart issues are frequently a side effect of the hyper T. Many of them will improve when you control the T4. There is a number, well actually I've skipped the proteins. Frequently on a test you will just see protein or total protein. It may be broken down into albumin and globulin. And if you're looking at close to the bottom of normal or below normal, there's a fair chance that there's a digestive issue, maybe something along the lines of inflammatory bowel disease, that will affect the absorption of nutrients, which lowers the protein levels, but it's also going to be reducing absorption of the medicine. So if you're having trouble controlling the T4 and you're looking at low normal or low protein, you probably should treat a digestive issue before you raise the dose of methimazole, particularly since the higher dose of methimazole can cause or increase digestive irritation, and you may make the problem worse, and you get caught in this loop where the T4 won't come down and you keep raising the dose, not realizing you're making the digestive problem worse, which is lowering the absorption of the medicine. Yeah. So keep an eye on the proteins. They can indicate other problems. Those are less common. I'm not going to get into them here. They usually don't directly relate to the hyper T. A test you will sometimes, but not always, see is the FPLI. That is to test for pancreatitis. If it is high, you probably are dealing with pancreatitis, which you may already know just based on symptoms. If it is not high, you may still be dealing with pancreatitis. The test will catch acute pancreatitis, but it will not tell you necessarily if a cat has chronic pancreatitis. Again, cats are weird, cats are complicated. You have to look at things in relationships, bigger pictures, and then you take your best guess. Okay, endocrinology, primarily there you are just looking at the thyroid numbers. The commonly used one for diagnostics is just called T4 or total T4. Usually that's all you need. Sometimes you also test free T4. Whether it really is a better test is questionable. But when you have a borderline T4, you may have a high T4, which is a stronger indication of hyperthyroidism. But you still have to look at symptoms before you decide whether or not to treat. Check out the video on borderline diagnosis. A full thyroid panel would be T4, free T4, T3, and TSH. The T3 is usually not significant in cats. It can be very low and still not meaningful. The TSH is the thyroid stimulating hormone produced by the pituitary. When you have a tumor causing the hyperthyroidism, and possibly, it's less clear in whether, in cases of non-tumor spikes, but the tumor will force the pituitary to stop producing TSH. So very low TSH or TSH that's too low to show on the test is a confirmation that you're dealing with hyperthyroidism. And the combination of T4, free T4, and TSH is also used after the I-131 if you are checking specifically for subclinical hypothyroidism, which would be when the T4 is low normal, but quite often the full panel will show that free T4 is low and TSH may be very high, which would indicate that the body is asking for more T4 and not getting it. And then you figure, okay, we have to supplement. Okay. Hopefully I haven't forgotten too much. That is a quick run through of those numbers, and I'm hoping I didn't confuse things too much. Always look, think, ask, and discuss. That's how you approach blood test numbers, combinations of numbers, and numbers relative to the cat. Never leave the cat out of the sequence. You consider symptoms, lack of symptoms, and what that tells you about the meaning of the numbers. Okay, now I need to go ahead and do the other video, and we'll see how that goes. And hopefully, somewhere along the line, I'll make a little bit of sense. But I've had cats around for a long, long time, so it's getting harder and harder to make sense as I try to understand cats. Talk to you later, and enjoy your furkin.